The healthcare system. Kareem Ross. The healthcare system is the organization of people, institutions, and resources that deliver healthcare services to meet the health needs of target population. The problem that lies at hand within the healthcare system is that there is a high percentage of the population that doesn't have insurance, which is considered the uninsured. The quality of some insurances doesn't make a difference from the uninsured. Private versus public hospitals needs improvement and artificial intelligence. The uninsured include the working poor and those who work for small businesses, working poor, homeless, and some deinstitutionalized mentally ill patients. Healthcare industry. Two general categories of health insurance in the United States. Private, which consists of traditional fee for service group contract, and public, which considers Medicare, Medicaid, stat children's health insurance program. Public hospitals versus private hospitals. Public hospitals are funded by local, state, and federal funds. As a result, they cannot turn anyone away. Even if someone who is entirely penniless comes in, the hospital must treat him or her. Private hospitals have the right to refuse treatment because they are privately owned. If you do not have insurance, they can turn you around whether it's a life or death matter. Private insurance. 70.2% of Americans have private insurance. Private insurance can be in the form of traditional fee-for-service insurance or group contract insurance. Traditional fee-for-service plans include a billing system in which the provider charges a fee for each service rendered. Group contract insurance, managed care systems represented by health maintenance organizations, HMOs, and preferred provider organizations, PPOs, are prepaid group practice plans that offer healthcare service to groups of medical practitioners. These are examples of private hospitals that require you to have insurance in order to be seen as a patient. Of public hospitals that we can, as citizens, have the right to attend if we do not have insurance. Medicare is a federal program that provides health coverage if you are 65 and older or have a severe disability, no matter your income. Medicare is the largest healthcare insurer in the U.S. Medicare consists of two separate parts. Hospital insurance Part A provides hospital insurance benefits that include up to 90 days of inpatient care annually with a 20% of insurance fee. Medical insurance Part B, an optional insurance program financed through premiums paid by enrollees and contributions from federal funds. Medicaid. Medicaid is a state and federal program that provides health coverage if you have a very low income. Eligible low-income persons, certain low-income pregnant women and children, the aged, blind, and people with disabilities, members of families with dependent children in which one parent is absent, incapacitated, or unemployed. The individual states define eligibility benefits and payment schedules. Typically, one must meet three criteria, including income, categorical, and resource. To date, 36 states' Medicaid programs offer certain forms of nutrition services provided by diet. Artificial intelligence. Regarded as the future of healthcare, the use of such technology is also very challenging for physicians, given the physician culture of autonomy and decision making. The idea of having computers dictate how medical care should be delivered is something that I think is very difficult for a lot of people in the medical community to really embrace. Such technology may prove useful, particularly with regard to robot assisted surgery and dosage error reduction, among other issues.